Hello there, I'm Dr. Sachin Kulkarni. I'm just narrating you a story of a case which I came across very recently. And this is a pretty common story all over of the clients we get. This is a couple with wife is 37-year-old and she has a low anti-Mullerian hormone level and a low ovarian reserve with AMH level of just zero point 0.6. Obviously, they're contemplating a pregnancy, but now, because of a low ovarian reserve and a high age, they're confused how fast they should go for pregnancy. The science definitely says, well, you should go rapidly towards a pregnancy. Well, as your age advances beyond 38 and 39 years of age, that the chances of having more aneuploid embryos or chromosomally abnormal embryos is high, and you should be expediting your treatment. But not everyone is ready for IVF. In such a scenario, is your chance of pregnancy without an IVF nearly zero? No, that's not the case. Because you have a zero point 0.6 AMH, in spite of that, you're still ovulating very well, and every month you're producing an egg. So there is a certain amount of chance of getting a natural pregnancy. The pressure point here, more than the AMH, is the age. Because the age is advancing, the kind of embryos you prepare, they may not be very well. They could be chromosomally abnormal. So the chance of natural pregnancy, though is there, but little lesser than any other sources. I would say you need to sit with your doctor and chart out a program wherein how many months can you go ahead with a natural chance? Should you really go for IUI? Is it worth it? Or should you go straight for IVF? And again, if you do an IVF, you should remember because the AMH is low, it's not just one cycle which will be sufficient. Because since you're less number of eggs, in spite of going through an IVF, you may have less eggs and less embryos. With less embryos, there could be less blastocysts. And less blastocysts means less euploid blastocysts. So chances of pregnancy are less, and IVF is a number game where we need more eggs, more embryos, more blastocysts, and more chromosomally blastocysts, normal blastocysts. So you may require to undergo 2 cycles of stimulation so as to get adequate number of blastocysts to do a justified cycle. To summarize, I can tell you that the answer to the question, do you have a natural chance of pregnancy? Yes, but little low. Do you need to hurry up for IVF? Yes, IVF gives you a better solution, no doubt, provided you're mentally, financially, and physically, emotionally ready to have 2 cycles of IVF so that you can get good number of blastocysts, more chromosomally normal blastocysts, and then your chance of pregnancy will be really high. Some of the women, in spite of after counseling about all these things, may opt even for donor eggs. So all these options need to be discussed with the doctors, the pros and cons and the costs and the benefits, and then one can take a decision. Thank you.